Hi, what's up, guys? Welcome back to another interesting episode on the show Behind the Scenes with Hell with Dr. Ron. If you're new to this channel, to this podcast, to this station, my name is Ronald and I talk about everything healthcare and all there is in between it, really. So if that's the kind of content you're looking for, just hit the subscribe button. So on today's episode, I'll be talking about, some of the things we should do or know as house officers. Now, I finished as a house officer, years ago, but recently I took a trip down memory lane and, it got me thinking. There wasn't really some sort of formal induction for house officers who are new to any hospital or unit. Though I'm aware that some hospitals are beginning to change their practice in Nigeria really by, organizing formal inductions for doctors, sort of give them bearing as to what they should be doing, what they should expect, do's and don'ts, and all of that. So I just thought I should share some insight as to what I think every house officer should know. So if you're a medical student watching me, or probably you're on your 600 level writing your final exams, this video will be very helpful to you to understand what to expect as a house officer. Now, I made a couple of notes down, so I'll just be looking intermittently to share those points and, talk a bit about them. Now, as a general overview, really, house job is essentially a year of training, is a year of intense learning, and I would say you should try to absorb as much as you can during your house job time, because typically after you're done with house job, it's quite a big challenge. Looking like my own experience when I finished house job, and because after house job you get a license to independent practice, and it could be quite challenging. So the more you know, the better for you, actually, right? So it's just to have that at the back of your mind that it's a year of learning and training, and it could be challenging. Sometimes it's not easy to get spots into house job, but when you get in, then you need to apply yourself judiciously. So I'll just talk about a couple of do's. Number one, but in no particular order, you have to always be punctual, right? You're the, in quote, lowest member in the hierarchy of the doctors, really, and you're expected to be the first. Come in, you do your own house officers rounds, do your documentation, and essentially the idea is just be punctual. We need to know we can rely on you. You should be on time, and it tells us you're really serious as an individual. Then the next one is to be neat. Now, back then, a lot of people dress shabbily. People might differ on this, really, that it doesn't matter what you wear and all of that, but I think it makes sense to be neat. So I know some institutions probably have dress codes. You must wear a tie. Just be neat, really, because it sort of gives a confidence, instills confidence of the patient, or the patients basically trust you when you're so neat, and when your shirt and your tie or dress just be neat, really. That's all they ask for. Now, your consultant should never come before you. So people will still argue for this, but it just shows you're responsible, really. Like I said, you're the first on call, sort of. So anything that happens in the unit, you should be always aware of what's going on in the unit. So you should be one step ahead, really. So unless maybe unforeseen circumstances, that's probably when your consultant should come before you, but ideally you should be there before your consultant. Always have all your stuff with you, equipment, really. Things like the stethoscope, your patellar hammer, your pen torch, your MDEX, if the case might be, or you probably leave that in clinics. So your little jotter and a paper, or a pen rather. So it doesn't make sense you're going to work without your tools, at least stethoscope. So then you have people who come to the ward, they're borrowing stats probably from the nurses or using the ward stethoscope. But at least if you're going to clinics or the ward, then you should have all your stuff with you. it makes it easier, it makes it less cumbersome for you. You don't want to be borrowing pen, borrowing paper, borrowing stethoscope, let me use this. And people are really, defensive when it comes to lending you stethoscopes and all of that. So you just want to go with your own. So every round, every clinic, make sure you're always prepared. Then in terms of morning rounds, you should do your own rounds first. So your reg or your senior reg shouldn't do their rounds before you come and do your own rounds, because that is the only way you can actually learn. You come in early, do your rounds first, make your own assessments, and document. So by the time the regis, the senior regis, and the consultants come, you get to see the difference between what you've done and what they've done. Remember, I said it's a training period, so nobody is going to fault you for anything because we assume you don't know so much, right? Then you should always know your patient. This one, they were always singing it like music in our ears. Always know your patient at every point in time. What are you managing for? What are the investigations that are pending? What medications is he or she on? I understand this might be a lot of information to take in, especially for people who, I remember then working in orthopedics, the whole ward was full of people, maybe like 1, 2, 3, 4, maybe like 40 people around. So imagine knowing the whole diagnosis for the whole 40 people, knowing all their medications. So just know your patients, really. That's all they ask for you. I mean, there's no person that should be on the ward that you are not aware, at least to an extent, of what's being done for that patient. So it sort of shows how serious you are, really. Then another thing you want to also ensure is to make sure all investigations are up to date in the folder or in the patient's folder notes. And because during ward rounds, after ward rounds, we usually request for investigations, do EUC, do full blood counts, do this, do this, do this. So you get to take the samples and they get sent to the lab. So it's your job to ensure they are up to date. Anyone that is pending, you note, it's just to show that you're making efforts to make sure that everything is updated. So if a consultant comes in and says, probably, why is the EUC not ready? So you know why it's not ready, or why the full blood count is not ready. You know why it is not ready, and you give those answers really. So that's basically the part of making sure all your investigations are up to date and you follow up on everything, really. Then you need to be courteous to patients, right? They're in their most vulnerable periods or conditions, really, by virtue of being admitted on the ward or coming to the clinic for treatment or whatever. So you have to be courteous to them. So we've had cases where doctors are rude, or nurses are rude, or healthcare workers are generally rude, and all of that. So that's a different conversation entirely. But as a baseline, you should be courteous to patients. When your team is in clinic, you should be in clinic, really. So you can't disappear when your team is in clinic, so that they don't call it truancy or whatever. Then before surgery, because when you start rotating pediatric surgery, obs and gynae, all those rotations. So when you get into surgery, part of what you'll be doing is pre-op, supporting pre-op care of patients, and that's still part of that is investigations, really. So you want to make sure all pre-op investigations have been done, results are out, and they'll be communicated to the registrars or put in the folders. Anyone that is pending, what I used to do is I look for the information. Why is it pending? Then I escalate, because at that point it's beyond me, really. So you just keep an eye on all those pre-op investigations. Now, in clinical presentations, you're going to be doing a lot of clinical presentations. Interestingly, a lot of people try to dodge clinical presentations, but that's the only way you can actually get better, at understanding all these illnesses and their management. So try to actively participate in these clinical presentations as much as possible. And some people will sometimes the clinical meetings might not go the way you expect. So you probably get a lot of criticism, and sometimes negative criticism, really, because it's supposed to be a learning environment. And a lot of persons are beginning to advocate, specialists or consultants or senior registrars, you don't have to insult to teach. This is another conversation for another day. Probably I get a couple of persons to come and talk about this, but teaching can be done without, humiliating doctors and all of that. So, but you want to actively participate in clinical presentations, because the more you talk about these illnesses, it becomes a good part of you, really. Then always ask questions. Don't assume anything. Nobody will kill you if you don't know the answer, and there's really no harm in not knowing. Even though here they probably expect you to know so much. Okay, you're fresh from medical school, you should know 30 causes of fever in this patient, or 50 causes of hernia, different stuff, really. But you have to sort of have an idea that of whatever they're asking you, and when you're not clear, you should always ask questions if you are not clear about whatever thing they're talking about, either if about the procedure, probably about the management protocol, whatever it is. Always ask questions when you are not clear. So if there's a consult, most times the consult will come to your table as the house officer. So it's your job to escalate that consult, to your registrar, or inform who is next on your team, really. So a consult is usually an invitation from another department to come and see another person. So if I'm working or rotating in pediatrics, right, and the orthopedic surgeon, they are seeing a child who has a fracture, they'll probably invite the pediatricians to come and, have a review. Probably maybe the baby is vomiting or something, so the pediatrician have to come in. So the orthopedic team will send a consult to the pediatricians, and if I'm the house officer in pediatrics, I get that letter, then I escalate as necessary. Then you want to respect everybody in the team. So it's not just the doctors you're respecting the nurses, you're respecting the porters, you're respecting the ward clerks, you're respecting every single member of the healthcare team, because nobody is bigger than the other, really, in my own perspective, really. So these are some of the things you should know, or we should know as house officers, really, that people didn't teach us, and we had to sort of learn on the way, which really didn't make sense. So kudos to those hospitals who are, making formalized induction programs for new house officers. I think that's something that should probably be scaled on a national basis, and standardize it, sort of. Then some of the don'ts of house job: you shouldn't come late to clinics, right? You shouldn't come late to ward rounds. You should not leave your duties undone. You're supposed to maybe post ward rounds. You're supposed to take blood samples from 5 people. For some weird reason, you just refuse to take those blood samples. It doesn't make sense, because that's impacting patient care ultimately. So who are you leaving it for? So try not to leave duties undone. Always take permission before you leave. You should not be rude to your superiors. You shouldn't fail to ask questions. I already talked about that. You shouldn't fail to ask questions anytime you're in the dark or you're confused. So you're better safe than sorry, and don't gossip about your patients. Don't gossip about your colleagues, really. I think I made a video about, staying safe on social media and all of that. So gossiping about our patients is one of those things that you don't want to get involved with. Just come, do your work, and go home. So I hope I've been able to shed some light, to the would-be house officers if you're watching me. So if you know somebody who is getting into house job, then you probably want to share this video with them, right? All right, thank you, and that's it from me on this episode. And until I see you in the next one, stay safe and bye for now.